Are generic brands of over-the-counter, you're already making a face. You're already making a face. Are those okay, or you think steer clear of the generic brands?
I always say spend money on your eyes. I stay clear of generic eye drops or even contact lens
Really?
solution. I think the end of last year, there was a big recall of generic eye drops.
Oh no!
You do not want to ever put your eyes in harm's way. Risk of blindness.
Okay,
You
say
know?
less. Say less.
more.
It is-
Okay.
It's one of those things, we use our eyes every single day. It's worthwhile spending the extra buck or two to give the best for your eyes.
For your eyes.
Welcome to Care Experts, a podcast dedicated to providing the inside scoop on health and self-care.
Make sure you join us each week for candid conversations with wellness and medical specialists.
Yes, real experts here to help you make the best choices for you and your loved ones.
I'm Melissa, a native Texan living in Atlanta.
And I'm Selah, a Californian through and through, and we're your co-hosts.
That's right. We're both proud moms here to have meaningful conversations with experts from all over the country who empower, inform, and inspire.
From cosmetic to dental and vet to vision, this is Care Experts. Hello, Melissa.
Hey there, Selah. How you doing, girl?
I'm good. How are you?
Really good. It's good to be back here and really have a chit chat where we are not interrupted by our kids or our husbands.
Yeah.
And all the time, right?
Agreed.
It's relentless.
Relentless.
Yeah.
Well, and today we have a very interesting subject.
What are we talking about?
The eyes.
Oh, because
But-
what do you always say? I mean, it's not just you. It's it's an expression that people say.
Yes, but I say it a lot.
What is
the
it?
eyes are the window to the soul.
Oh, can you see my soul right now?
I can see your soul. And your beautiful brown eyes. Melissa has beautiful eyes. If
Oh,
you're
thank
not
you. Your
watching.
eyes are really pretty too.
Thank
I love
you,
your
Melissa.
eyes. But we're talking about dry eyes.
Yeah,
today?
which I definitely can get dry eyes.
Really?
Yeah. Oh,
why?
did you know this trick, by the way?
What?
I can wet my eyes by fake yawning, like that.
Oh,
I just did
for
not.
people who are just listening and not watching, she did this weird open mouth thing. What was that?
It was like a snort.
But it works.
But it worked.
Okay.
My eyes are wet. But
So now your eyes are wet from
Yes.
that weird mouth opening.
Do you
snort
not
thing.
do that?
No, it's
Okay,
not.
this was just my little
common.
trick
Well,
then.
I appreciate that.
You're
it's
welcome.
a life hack.
You're welcome.
Okay, yeah.
Yeah, life
but
hack.
dry eye is something that is prevalent, apparently, right?
Well, I think we're going to find out today how prevalent with our guests.
Yeah, I thought, and you know what's funny? I mean, not funny, haha, but funny, weird. I thought dry eye was just something that a few people get occasionally, right? Like my parents, because they're older, and that's just what happens to you when you get
No.
older. I know.
Very common, I think. I mean, I have it. I'm not that old.
Well, you're not my parents' age,
And I'm not
that's
your
for
parents'
sure.
age, yeah.
So I'm excited to talk to our expert, who is Dr. Precious Hwang. And she, of course, knows all about the eyes, vision as a whole, and of course, she will be able to explain
Yes.
what dry eye actually is.
That's right, because she is a glaucoma-certified optometrist at Rancho Santa Margarita Optometry in Southern California.
And she graduated from the Southern California College of Optometry, cum laude.
Ooh. And Dr. Hwang specializes in treating and managing ocular diseases, fitting hard and soft contact lenses, and co-managing cataract and LASIK patients.
Sounds like she's very well qualified for this conversation.
That's right.
Let's bring in Dr.
Let's
Precious
bring her
Hwang.
in. Hello, Dr. Hwang.
Dr. Precious Hwang joining us today on the pod.
Yes.
I love it.
By the way, I love your name, Precious.
Thank
How did your
you.
parents choose it? Or how did that come about?
So I'm one of 3 girls, and I am actually the middle child.
Oh, I'm a middle child.
My elder sister is Esther. My younger sister is Grace. So when my mom was pregnant with me, the doctor had told them that I was a boy.
Oh.
Good old technology.
Good old technology.
Before, yeah.
Right. So I think my parents had this conception, or, I don't blame them. The doctor told them that I was going to be a boy. So I think initially my name was supposed to be David. But when I was born, actually my mom was a little disappointed that I was not a boy.
Oh my
I don't blame her again. I mean, they
Yeah,
had
yeah.
this.
Yes.
And my
Gender
dad,
disappointment is real.
Yeah, my dad told her, "Oh, don't be sad because she's precious to us." And so I just have a very unique name.
I literally got tears in my
I
eyes.
know, that's so sweet.
She's precious to us.
She's precious, and now she's a precious
Love that.
optometrist.
Have you told that
right?
story millions of times? I'm
Here
sure.
and there, here and
Yes.
there. I know people do get curious.
Yeah, it's so unique. I love that name.
Right.
though.
It's fun to call the vet. They're like,
oh.
no, we need your name, not the dog's name.
Oh my goodness, that's hilarious.
I want to talk about your dog later.
Yes.
So you're an optometrist,
Yes.
Dr. Hwang. Okay, what made you decide I want to study to become an eye doctor?
Right. Initially, I wanted to become a dentist.
Oh.
But in my last year of college, I decided that was not the way for me. And so I wanted something where I had time to spend and talk with patients, basically patient care, and something more lighthearted, lively. And I
Yeah.
just really came to really love working with patients in my field. And it's just been great. And best decision I ever made.
Wow, that's great.
So today, it's great getting to know you, but we're talking about dry eye today.
Yes.
For the longest, I thought that was just like an adjective, a description of like, oh, my eyes feel a little dry today.
You didn't know it was like an actual
Like medical
diagnosis.
term or
Yeah.
a medical diagnosis. What is dry eye, Dr. Hwang?
Right. Dry eye is a condition. It can have so many symptoms. It can be blurred vision, red, irritated eyes, gritty, sandy sensation, light sensitivity, tearing. But it's typically caused by either your eyes are not producing enough tears, or those tears produced by your eyes are evaporating sooner than they should, or a combination of everything. It's actually called a multifactorial disease.
Oh.
It is something that, in my opinion, affects all of us to some degree. It's very common with age, certain ethnicities, occupations, hobbies, things like that. It's everywhere.
Wow. Is it common in contact lens wearers?
Very common.
Because
Very
I remember before I had LASIK, I was wearing contact lenses and I would have to like find a moment to go like this and like really
Right.
wet my eyes. It was so annoying, which is why I got LASIK.
For those of you listening and not watching, Selah is squinting very hard right now with her eyes like shutting them. Yeah. Because not everybody knows that you
Exactly.
have an extensive background in performing in
Right.
theater and you'd be on stage.
Exactly. I was
doing
telling
this
Melissa.
in character?
In character, which is not in character,
Right.
because you're like
Breaking
finding a moment to
character.
go like this,
Oh,
turning your
man.
back. It
Yeah.
was horrible. It was definitely a job, like, what is that called? Like you're not able to do your job properly.
Oh, no.
Impairment.
Oh, my
because of that.
goodness.
Yeah.
How do you diagnose dry eye?
Dry eye. A lot of ways to diagnose dryness. So we look at, if you have any complaints or any symptoms that patients will bring to us. But at your routine eye exam, when we look at your eyes, we look for signs that we see. And knowing that it can also affect your vision, we look at a number of things. But typically, during your routine eye exam, we use a microscope to check the front surface of your eyes. We check your gland production. We check how fast those tears evaporate with each blink of your eye. We look at the appearance of your eyes. A lot of things that we use, a lot of tools that we have.
Wait, you can check how quickly the tears evaporate?
Yes.
Oh my gosh, technology!
Amazing.
Once again,
Yeah.
that is incredible.
Definitely. Do I have to go to the eye doctor to do this now that I've had LASIK? Although my LASIK was 15 years ago. Is it important to go get checked? Because I don't feel like I have dry eye anymore.
Right. It is important regardless of your age, whether you have perfect vision or whether you had LASIK or any kind of refractive surgery like PRK. Come in every year, once a year. A lot of folks don't even realize that their eyes are dry. They might also attribute to, oh, I'm just tired. I've just been on the screen all day. Oh, it's the allergies. It's this or that. But we want to make sure and kind of cover all of our bases. And it's really easy to come see us too.
I need to do that. I
don't
need
bite.
to do that. Put it on the list.
What are the different types of dry eye, and are there like levels to dryness?
Yes.
Okay.
So one is aqueous production, and that's how much your glands produce your tears. And the other is evaporative dry eye. The tears are just kind of leaving sooner than they should. It's a combination of both, but I would say more folks, due to our lifestyles these days, kind of geared towards more the evaporative dry eye, especially in younger populations. When we look at screens, whether we're at work, school, or looking at our little screen or the big screen on the wall, our phones and televisions, we don't blink very often. By not blinking, that's one of the main drivers for the eyes to dry out. Those tears are evaporating sooner than they should. Also, the environment, fans, ACs, windows open will also dry out your eyes.
Oh.
Yeah,
I had no idea.
right.
Well, whenever my dad gets in my car, he's always like moving my vents.
Yep.
I'm like, Dad, what are you doing? Are you hot? Are you cold? He's like, no, it's blowing in my eyes. I have dry eye.
Oh,
I'm like,
really?
yeah.
Oh,
So
so I
every
was
single
already
time.
aware of this.
Yeah.
Oh.
Right. And just even things like the main part is also staring at screens.
Oh,
We don't blink very frequently when we focus or read. So again, the tears evaporate from the eyes. A lot of things. Contact lens wearers. Contact
She's
lens,
pointing at me,
yep.
guys. If you're listening, she's pointing to me.
Yeah.
Well, that's what I experienced with contacts. And
Yeah.
also, as an actress on TV and film, you're not supposed to blink a lot.
Oh, is that right?
Yeah,
I wasn't aware of that.
Watch. It's better.
I'm
It's
gonna
more
see it.
effective acting.
Oh.
If you can hold your stare.
Oh.
And so I would also notice my eyes getting dry from that. And I feel like that is, I mean, definitely people who don't
right.
blink as much probably suffer from, right?
Mhm.
That's interesting. What about kids? Do they get dry eye or do you diagnose it in kids?
Kids can also get dry eyes. A lot of times it's also associated with allergies. Like if they have seasonal allergies, those can kind of go hand in hand with dryness.
Oh.
Knowing kiddos are on screens longer or much more frequently these days, we have seen an uptick that dry eye can occur in the younger population. Medications. Certain medications can also cause dry eye. It's actually a pretty common side effect from certain medications. So some kids are on medications for depression, which can cause dryness as well. A lot of things. It's multifactorial, yes.
Lots of contributing factors, as with
Yes.
many things. What are some of the most common symptoms of dry eye?
I would say on a cosmetic level, redness. Doc, my eyes are red or yellow. They don't look very fresh. Other common symptoms are greediness or sandy sensation, pain, stinging, burning, teary eye, which always throws people off. They're like, Doc, my eyes aren't dry. They water.
Okay, wait.
All the time. That's
No,
my
I have
husband.
that too.
My husband's left eye waters all the time.
Oh my gosh. Mine water a lot like that if I don't blink.
Yes.
When I want to cry on camera, that's my trick. Don't tell anyone.
wow.
But
I
won't. Because if I don't blink, they'll just start, I won't do it right now. Don't want to make you sad. But
Oh, goodness. On cue. And action. Action. We're in the scene right now.
But so that is very interesting. So tearing
Right.
up like that is actually a sign of dry
It is.
eye.
So it's a reflex. When your eyes are overly dry, the inflammation, the pain, we have nerves on the front part of the eye called the cornea. When they sense that they're dry, they'll send signals to overproduce tears.
Wow.
And that's why one or both eyes will just start watering, and patients will be like, "Oh, what's going on?"
Now I
right?
know every actor's trick.
Oh
That's
my
so
gosh.
crazy. Wow. And what about eye drops to wet your eyes when they're dry? What do you think
Right.
about those?
It's great. So, all of us, just like your skin changes with age or with birthdays, our eyes will change as well. We put lotion on our skin, we put chapstick on our lips, we put drops in the eyes. We're basically replenishing the tears lost either through evaporation or maybe your eyes aren't producing enough tears. It helps reduce our symptoms, makes us feel better, helps with the blurred vision, burning, stinging, gritty sensation, redness, irritation, even with the watery eyes, because we're preventing our eyes from getting overly dry from
Right.
watering. Artificial tears are one of the first-hand treatments a lot of us will recommend. It's easy. They're over the counter. You don't need a prescription for these drops. You can use them on a more regimental basis or more on an as-needed basis depending on the severity of your symptoms.
But they're artificial tears, not like Visine.
No Visine, no clear
My
eyes.
husband uses that every day.
So what are the over-the-counter
Yeah.
medications that
Sure.
that someone could go and get if they're
Right.
experiencing some dry eye symptoms?
Brands that I recommend are Sustain is a great brand. Also Refresh. Drops like Retain.
Yeah.
TheraTears. There's a lot of good brands out in the market, which are all over the counter, easily accessible. You find them everywhere. Drugstores, Costco, even some
Okay.
doctor offices will
Good
carry
to
them.
know.
Right.
Oh man. So I got to tell my husband. And the other thing is with that is bloodshot eyes
Yes.
from lack of sleep. That would
Mom,
be me.
that's
Yes.
us. Yeah.
What is that similar to dry eye? Is that dry eye or what is? Okay.
Yes.
Bloodshot
Majority of the time, it is a symptom of dry eye, red eyes. So the white part of your eye is called the conjunctiva. There are very fine capillaries or blood vessels embedded in the white part of your eye.
Okay.
When your eyes are dry, they're deprived of oxygen, nutrients. So your blood vessels dilate, giving the appearance of red, tired eyes. Also associated with fatigue, like if you don't sleep well, staring at screens all day. The artificial tears may help with the symptoms. Sometimes patients ask me, is there anything else I can use? I have a wedding. I'm getting photos done, family
Yeah.
reunion. there is a drop called Lumify.
Oh,
So,
Lumify.
so I always let
I use
patients.
Lumify.
Yeah,
You sent me that. Yeah.
I use Lumify.
Okay.
It's a patient favorite at the office. So I just like to educate. Lumify does not treat dry eye or allergies, but definitely gives you that white and bright eyes. Much safer,
let me see
much
your
more
eyes.
effective
I
than
forgot to use
Visine
it
or
today.
Clear Eyes.
Don't look now. Don't look
That's
today. I didn't do it
right.
today. I didn't do it today. But you know what? I'm glad you mentioned allergies because, and I always do them. I do my eye drops prior to putting my contact lenses in.
Perfect.
in the
Oh,
morning,
smart.
Which I hope that's the right way.
Yeah,
I'm
that's
doing the right
perfect.
way.
That's
Okay.
I was like,
perfect.
sounded
And I
smart
gi-
to me.
And I give it a few minutes before I put my contact lenses in, right? So I'm like brushing my teeth and give the
Yeah,
time.
to settle
But
in.
I use like something it's like an antihistamine. It starts with a Z. It's in an orange
Yes,
box.
Zatador.
Yes, I use that because during allergy season, which feels like
Your
year
eyes
round
are, like,
now,
itchy.
oh my gosh, itching and burning and watering and stuff.
Right.
First thing in the morning before I've even gone outside.
Right.
Yeah, and I have a
gosh.
cousin who's an optometrist, and so she said that that's what
Awesome.
I should be using.
Oh,
so
see, I've
that's how
never
I
even
know.
heard of that.
Yeah.
Yeah.
Wow.
Because otherwise, I'm that person who would have just gone and picked up Visine or whatever.
Yeah.
The one that came to mind that we've all heard of. That's what I would have
Right.
chosen.
Exactly.
Is there a prescription medication for more severe cases of dry eye, Dr. Hwang?
So what's great is a couple of years ago, prescription medications for allergies are now over the counter.
Oh.
So if you ever heard of Pataday, Pataday is an excellent allergy drop. There's 3 different kinds. My favorite is Pataday Extra Strength.
Okay.
Over the counter, 1 drop in each eye once a day, typically 10 minutes before you wear contact lenses if you do wear contacts. It alleviates the red, itchy, watery eyes associated with allergies. And yeah, sometimes I also feel that allergies are year round, or if you're going from a different area to another, like traveling, like, my goodness, what
Yes.
happened?
What happened here? Yeah.
Definitely.
Right,
Yeah.
right.
What about for dry eyes? Are there prescription medications for that as well if you have a more severe case?
Yes. So
Okay.
depending on the severity and also the cause of your dry eye, there are drops like if you heard of Zydra or Zedra, Restasis,
Restasis, I've heard of
Mibo.
I've heard of that.
Mhm.
Yeah.
These are prescription medications that people use daily to help your eyes produce its own tears, kind of equalize that tear film layer, kind of help with the symptoms. When the over-the-counter easy methods aren't working, we go
Okay.
to the next step.
So it's like if your dry eyes are even
Right.
pretty bad.
Right.
Are generic brands of over-the-counter? You're already making a face. You're already making a face. Are those okay, or you think steer clear of the generic brands?
I always say spend money on your eyes.
Okay,
So I am
okay.
actually a
Makes sense to me.
really cheap person.
Are you?
I like to save a buck. You can ask Melissa.
There's nothing wrong with
I
saving a
am
little bit of money. Nothing wrong
frugal-
with that.
I think also
Franny
being a
over
mom.
here.
Also being
Sure.
a mom. You
That's
know,
true.
my kids come first. My family comes first.
And they're very expensive.
I've almost put myself on the back burner. I stay clear of generic eye drops or even contact lens
Really?
solution.
Mm-hmm,
I think the end of last year, there was a big recall of generic eye drops.
Oh no.
You do not want to ever put your eyes in harm's way, risk of blindness.
Okay.
You
say
know?
less. Say less.
No more.
It is.
Okay.
It's one of those things. We use our eyes every single day. It's worthwhile spending the extra buck or two to give the best for your eyes.
Eyes.
That
For
is
your
so-
eyes.
Right.
I have a random question.
Yes.
My eye twitches from time to time, like out of control. I'm like, oh my gosh, somebody's look. Everyone's saying it. You know, it's very embarrassing. I feel like everyone's saying it, even though they're probably not. But I think it's from lack of sleep. But what is it
What
from?
kind of-
Yeah, what is?
yeah.
How do I stop it?
You are correct.
Lack of sleep.
Yeah.
It tends to happen. when
Right.
I'm
There's a
sleep-deprived.
condition called myokemia, which is basically lid twitching. It's usually caused by lack of sleep or fatigue, stress, or over caffeination.
Oh, got all 3 of those. Check. Definitely all 3.
And things to kind of reverse it: more sleep, less stress, less caffeination.
I'm gonna take away my 4 coffees a day. Or I mean, maybe
That's excessive.
Yeah,
That's
it's
excessive.
probably
I will say it's
excessive.
common. It is the common
Okay.
thing that
Amongst
patients will
moms.
bring up. Yes.
The eye twitching moms
Yes.
club.
I'll say students and moms. Like,
Yeah.
it's
Yeah.
usually
Students.
Oh, students and moms. Yeah.
Yes.
Are there natural treatments, Dr. Hwang, for dry eyes? Or
Yes.
home remedies?
Yes. One very common and popular treatment is a warm compress eye mask.
Oh.
It always throws people off when I talk about it, but essentially, one of the main causes of dry eye isn't because your eyes don't produce enough tears. They're evaporating much sooner than they should.
Okay.
We have oil glands right where our eyelashes grow. They're called meibomian glands. They produce oil every time you blink. If you think about oil sits on top of water, it prevents evaporation. Because generally as a population, due to our lifestyle, we're not blinking very frequently as we used to, those oil glands dry up. So they're not as effective as they used to be. By doing the warm compress at nighttime, it basically, I like to say, kickstarts those oil glands.
Oh, cool.
Keep them moving, keep them flowing. It's also a great treatment for busy moms.
Yeah.
It's like a spa treatment.
It's a little treatment. Sorry, I can't talk to you right now. I've got to do my eye treatment.
Yes, honey.
Yeah, it's over the counter. You just need a microwave, put it over your eyes at nighttime.
Perfect.
And warm, not hot.
Oh, yeah.
Yeah.
You can always test it on your arm before you put
it
that
on
sucker
your
on.
face. Yeah.
Fish oil or omega-3 fatty acids. It's actually a great treatment for dry eye. That's natural, over the counter.
Just taking a supplement, you mean?
Yes, taking a supplement, right.
I take
People
those.
You already do?
Oh, yes, every
Oh,
day.
I don't do it.
Fish
I don't do it.
oils.
I need to do it.
Yeah.
I know.
I mean, it's overall great for your health. Think of dry eye also as an inflammatory condition. That's why you have the redness, the pain, the itty-gritty sensation. Also think of the oil glands that I kind of mentioned earlier.
Right.
It helps with overall health check of the eyes, reducing the inflammation, great for, just everything, and just overall, like, easy.
I'm sure we're going to go on TikTok and see someone literally putting oil in
Oh,
their
stop it. Oh, my gosh.
Don't do that.
Do not go to Dr. TikTok for
Dr.
your
TikTok.
eyes or any other social media platform. Trust our experts here on
Exactly.
Care Experts because they
Yes.
have the credentials, okay, to support all of these explanations that they are giving us,
It is
okay?
so true. What are some other things, like how often should people replace their contact lenses for dry eyes?
Right.
If you're a patient of dry eyes.
Right. Replace your contact lenses as directed. So if you wear a monthly contact lens, replace it every 31 days, 2 weeks, every 2 weeks. You do not want to stretch your contact lenses.
Oh my gosh,
Some-
I used to do that.
It is
in
pretty
college.
common.
Yeah. Because I was so
Yeah.
broke. I
Yeah.
would
Yeah.
stretch them out as long,
Right. It's usually
way past
That
the
was
due
before
date.
you found out
reason.
about
Yeah.
CareCredit.
Right.
Oh, that was
right.
many moons ago.
Seriously, yeah.
Yeah, that's true.
Yeah, patients will say, these are expensive. I want to use them as much as I can. My eyes feel okay.
Yep.
But in the long run, you are causing more dryness and also increasing your risk of eye infections, like an ulcer or bacterial infection.
Man, I was living on the edge.
Right. In general, though, and I'm I'm really big on this. Daily disposable contact lenses, especially those from a material called silicone hydrogel, are the best option for dry eyes for contact lens wearers. They're great.
I should have done that.
Can you reverse dry eye?
There is no cure for dry eye, but it's managing and treating the symptoms and the severity. So definitely we can work on improving the symptoms and also improving the appearance or the signs of the dryness on your eyes. So that red, irritated eye, the watery eye, the inflammation on our eyelids, we can actually reverse those appearances.
Oh, great.
But dry eye is also a chronic condition. It will never fully go away for most folks. It comes and goes, it gets better, it gets worse. Typically, for a lot of us with age, it might be going on the worst trend.
Oh.
But as long as we can treat it, we can manage it easy. Like
Doing
it's something
those
that we
warm
can
eye
do.
compresses.
Yes.
I'm definitely going to start doing that.
Yeah, that
And
sounds
just,
amazing.
feel good, like a little
Yeah.
spa treatment every day.
Totally. Easy
Self-care.
peasy.
It's self-care.
Self-care. Yep.
It's not selfish, it's self-care.
Yes. Now, when do people take a break from contact lenses or switch to glasses full time with dry eyes? Should they?
It depends. Some folks naturally they just decide I do not want to deal with my dry eyes from the contact lenses, and they switch to glasses.
Okay.
My husband is one of them.
Oh.
He also works on a computer all day, and he just
Yeah.
found that, hey, wearing glasses are just more comfortable for him in general. Also, the glasses provide the blue light filter or the blue blocker protection. For contact lenses, we do have patients that their eyes are just overly dry and they just cannot stand it, but they don't talk to their eye doctor. They just say, you know what, it's not for me. I'm not going to explore any other options. And they switch to glasses. But there's a number of reasons why patients do transition out of contact lenses. LASIK.
Yeah.
Or Pure K is one of them. Yes.
Yes.
Right, right. So it's not always a bad thing.
Right. Totally.
What are some of the things that we can do to make accommodations for ourselves at home or at our workplace to minimize the effects of dry and put ourselves in the best position?
Right. So because dry eye is a multifactorial disease, we have to look at the environment. So folks that work on a screen all day, which most of us do these days, take breaks. So there's something called the 20-20-20 rule, where every 20 minutes of screen time or work, you look 20 feet away, blink or rest your eyes for about 20 seconds, and then return to your work. It helps relax the eyes, prevent eye strain and eye fatigue. And just by relaxing or blinking your eyes, you're replenishing those tears lost. Just your office space, look around. What is causing your eyes to get dry? Open windows, ceiling fans, AC like blasting through the vents. These things will naturally dry out your eyes as well.
Would a humidifier help?
Yes,
Oh,
yeah.
okay.
Good.
So
Air filters, humidifiers. Okay.
humidifier, easy investment. We have some patients that when they sleep, their eyes don't shut all the way.
Really?
Yes, yes.
How do you know if that's you?
Sometimes,
I don't know.
If you
Should I
have-
film myself sleeping?
if you have a observant spouse, they will let you know, like, honey, what's going on?
Yeah.
That's creepy.
Yeah.
Open.
Yeah.
Believe it or not, it's something that we can also see during your routine eye exam with a microscope. We'll be like, hey,
Oh.
has anyone ever told you don't blink completely or you sleep with your eyes slightly open?
Oh my
By
god.
using a humidifier, you're just basically helping moisturize your eyes. Yeah.
Actually,
go ahead.
I was gonna say, come to think of it, I think one of my kids does that. That's so funny. When he was a baby, I gotta check him now. Yeah, intervene now. It's-
right now.
yeah.
Is there a certain position that you can put your screens in that helps with decreasing the dry eye symptoms,
strain,
like
yeah.
the strain on your eyes? Really?
Right. I would say for strain, folks that have a big monitor about arm's length away, that's probably more relaxing or natural.
Okay.
Folks that work on their phone or a little laptop all day, because you're focused on that small little screen, it may cause more eye strain, eye fatigue, may contribute to dryness overall.
Okay.
But there's a lot of things that we can do at home. Lighting plays a big role as well.
Oh.
Some of us like it really bright. Others, like my husband, he likes to work in the dark.
A
or
dim
like-
setting. It's mood lighting.
Mood
It's
lighting.
mood lighting. It's a dim setting.
Right.
Is it better to work
right.
in a darker?
I would say, I always say, light is your friend, light helps you see, but generally we're all different, right?
Right.
Some folks are more light sensitive. Other folks just like the contrast of their screen against the dim lit area.
yeah.
I say, do what works best for you, but my general rule of thumb is light is your friend. Light helps
Okay.
you see too much, and of course it's not great.
Right,
you don't
right,
be
right.
looking at a blaring light all day,
Yeah.
but
Yeah, but it's
generally it does help you
so
see.
you're not straining.
You're
That
not
makes sense.
straining.
When you're scrolling on your phone at night, we all do it.
I
Don't
know.
deny it. When you're scrolling on your phone, one of the things I do automatically is I decrease the brightness on my
Yes.
screen.
Yes, I
and
do
if I already
that.
have my contacts out, I have to hold it a little bit closer, so that makes me hyper aware of its brightness. Is
Yeah.
that a good practice to decrease that,
Yes,
especially if
yes.
it's completely dark in the room? I really
Right.
decrease the brightness.
And you
Right.
think the new iPhone, I don't know about Android, but they have that light.
They have an option,
thing,
right.
dark light,
what does it
whatever.
do?
Yours might be doing it automatically. It's,
I have an iPhone. I don't have an Android.
no, I'm saying the iPhone
Oh,
does it automatically.
Oh,
At
it
7
does
o'clock
do
at
that.
night, it switches.
Yeah.
To the
For sure, for
whatever
sure.
it's called,
Right.
dark light or
right.
something, right?
Right.
Okay,
It's
so
like
that's
night
good.
mode or something.
Night
I have it
mode.
on my
that
phone
makes
as well.
sense.
Yeah.
Okay, that makes
Yeah.
sense. Yeah.
It's probably automatic.
Probably.
I don't know. And how do you work with your doctor, your eye doctor, to develop a safe contact lens wearing schedule? Like how you were saying, make sure you get. How do you choose which one's right for you? Monthly, 2 weeks, disposable daily?
Right. So a lot of things go into play. We look at how often you're wearing your contact lenses.
Okay.
Some patients only wear them for sports or hobbies.
Oh.
Daily disposables it is.
Oh.
Other folks, like there are some patients because of their prescription, it only comes in monthly lenses.
Oh.
So with those patients, we work on, hey, maybe limiting the amount of hours you wear your contacts during the day or the glasses at nighttime, using artificial tears on top of your contacts to lubricate your eyes. There's that option. Everything else, we look at, are your eyes dry? Are you irritated? Are you happy with the brand? Are your eyes feeling great? Are you tired, itchy, scratchy, gritty sensation? But usually what I recommend is, you want to do what's best for your eyes. And again, daily disposables, I'm a believer.
Yeah,
I love the convenience. I love that's the healthiest option for the eyes. It's well worth it, well worth it.
What are the costs associated with dry eye treatments?
Unfortunately, there is a financial aspect of dry eyes. If you think about purchasing artificial tears, when you run out, you got to buy a new one. Prescription eye drops tend to cost more than over-the-counter eye drops, so that has a cost associated as well. Warm compresses, fish oil supplements, purchasing a humidifier,
Yeah.
all these things eventually do have a financial aspect. But it's definitely doable. It's not like
it's
buying a
minimal.
car.
Yeah. Yeah, or having LASIK or something like that.
Right.
But these appointments and even the contact lenses, could
yes.
you pay for that through the CareCredit credit card?
Of course.
Okay,
Yeah.
finance it that way?
Right. So, contact lenses, even the dry eye treatments that we have at the office, if you've ever heard of like IPL, yes,
Okay.
LASIK, PRK.
What is PRK?
Yeah, IPL, PRK.
Sure.
Yeah.
So PRK is just like LASIK in the fact that it corrects your vision. It's a
Okay.
refractive surgery. LASIK is typically what's done for the majority of people these days. One and done, you go in, they zap you, you get cool sunglasses, you're seeing 20/20 the next day. PRK is an option for patients who may not have like thick corneas for the
Okay.
prescription. They're essentially not great candidates for LASIK. There is a slightly longer healing process with PRK, but in the end, they also get 20/20 or 20/15 perfect vision.
Wow.
It is a surgery to correct vision to give you freedom from
that
glasses
the
or contact
blade?
lenses.
Or
A
no?
little bit.
little bit
It's
of
a
that
little
whole-
gnarly. It's
Okay.
one of those things. I'm like, don't YouTube it, just go for it.
Oh gosh, I would never. No.
Nope.
No, and for that type of medical intervention with your eyes, does your practice offer CareCredit as an option to pay for that?
Not my practice per se. My practice, we are all optometrists.
Right.
LASIK and PRK are done through
Ophthalmologists.
ophthalmologists,
Okay.
which we have a great group that we work with and I send our patients. And I believe that group also takes CareCredit.
Great.
Awesome. Awesome.
I found out my vet takes CareCredit.
Yes.
So many places do. We are
I
learning
know.
this as well.
We're learning it too. All right, you know what time it is.
Ask the expert.
Ask the expert. These are listener questions, right,
Yes.
Dr. Hwang? So you are the expert in this case, not us. We're just going to ask the questions. Okay.
Oh, this is a great one. I've often wondered this. Can eye makeup cause dry eye? Are there products I should avoid, such as eyeliner or mascara? First of all, I will never avoid them.
I was just thinking that, like, I
But-
can't avoid them, but
Yeah.
that's not your question, though.
No,
That's the
this is
listener.
the
That's one of our
listener's
listeners.
question.
Yeah.
Yes.
Can it cause dry eye?
So there's a reason why I think women have more dry eyes than women.
Yeah, that makes sense.
So the answer
You
is
know, in
yes.
addition
Yeah.
to our hormones and, a lot of other things going on in our busy lives, makeup,
Oh.
whether it's eyeliner, mascara, waterproof, non-waterproof, what have
Okay.
you, all these things can affect dryness. So in general, I mean, I won't stop wearing makeup.
No, I mean, that's never going to happen.
But, healthy habits again at nighttime, remove your makeup completely. Any
Oh.
debris that's left in your eyes can cause redness, irritation, just dryness overall.
Oh my
I-
gosh. So always take off your eye makeup.
Yes.
Not Selah.
No, it's like I know this, but sometimes I just like I
I
fall
get it.
asleep.
Yeah,
I'm
'cause
tired.
you're exhausted.
Yeah, exactly.
Right.
Yeah.
Sometimes waterproof makeup or certain chemicals in makeup products can irritate your eyes.
Okay.
So just be mindful of these products. We're all different. We're all sensitive to different things, some more than others. So kind of be mindful of what you're
Okay.
using. Read those little fine details. And this is one thing I know a lot of women don't want to hear.
Uh-oh.
False lashes, lash extensions can also contribute to
And she's
dry
looking
eye.
right over here at us. Looking right at us about that too. Well,
Where's my sunglasses?
I know. We should have done this interview with our behind us.
Right. But it's
She would have known.
all a balance, So obviously, if
funny.
you're experiencing severe symptoms, getting styes, getting red, irritated eyes, go see your optometrist and see,
Okay.
hey, is it what I'm doing that's causing this, or is there something else? We're always looking at underlying causes. It can be age, ethnicity, medications, makeup, hormones, anything, right? And that's the importance of
crazy.
seeing your eye doctor.
Yeah, absolutely.
I feel like you just
Right.
answered this question, but this is also from a listener. It's really a follow up to what we were just speaking about. My eyes are typically dry after removing my makeup. Could these be caused from makeup wipes or an underlying eye issue?
Yes.
She's like, both.
Both.
Yeah.
It can be both.
Yeah.
I will say certain makeup wipes or oils can be irritating. They just dry everything out,
Yeah.
especially if you wear like waterproof makeup. So just be mindful of the products that you use. There are also underlying conditions as well. People don't realize even things like thyroid conditions, autoimmune conditions, certain medications that we're taking, like antihistamines can dry out your eyes, diuretics can dry out your eyes. A lot of things can attribute to these symptoms. But if you notice, like, yeah, right after I remove my eye makeup, my eyes are really red, irritated, I have to blink to kind of refocus. It might be that makeup remover or just the makeup in general.
Or the makeup, yeah. Okay, this person wants to know, can I use eye drops too much?
Ooh, good question.
that is a good
Great
question.
question. Sometimes too much of a thing is not a good thing.
Yeah, absolutely.
So artificial tears that we purchase over the counter, they do have preservatives in them. Using those artificial tears, four times a day, not a problem. If you find yourself using those drops 10, 15, 20 times a day, sometimes those preservatives will actually irritate your eyes more than the artificial tears are helping your symptoms. One switch to go to is preservative-free artificial tears, which have no preservatives, very close to your natural tears. But I always say, if you're finding yourself drowning your eyes with tears, again, come see your eye doctor. We're looking at that underlying cause.
Get to the root of the problem.
Right. Is it tear production? Is it evaporation? Did you have LASIK? What's going on? Are you outside during the day or staring at a screen?
So your contacts,
Yeah, we're just
whatever,
checking everything, kind of treating or finding the underlying cause or source.
Yeah, that makes sense.
Yeah.
But that's why you need to go to a professional, an expert
Yes.
like Dr. Precious Hwang.
That's why I need
so
to
you
make
can
my
get
eye
your-
doctor appointment.
Well, you and me both. We both
Yes.
need to do it, right? Are there any dry eye drops that also brighten the whites of your eyes?
Yes. Lumify is
Oh,
a
it's
favorite.
Lumify.
My analogy with Lumify is think of it as makeup for your eyes.
Wow.
And it doesn't really treat dry eye or allergies per se, but it makes them white and bright.
Oh, I need
One drop
this.
in both eyes. I love it myself. But I always say that's in addition to actually treating the dry eye. But who wants to go out with red eyes, irritated eyes? Like, hey, I'm going to my reunion and I look horrible. I do not want people asking me, like, are you okay?
What happened?
Have you
What
slept in the
happened?
last
What have you been through?
Right, right. But that is a safe and effective drop to use.
Okay.
Better than Visine, better than Clear Eyes.
Oh, wow. Good to know.
Safer to use as well.
Okay.
You can find it everywhere. Costco also carries it.
Okay.
Right.
Oh, you know what? This brings up another question I had, Dr. Hwang. If I use Lumify, but then I'm also having allergy issues, can I use more than one type of eye drop at a time? And
good
if so, if yes, in which order do I use them?
Good question.
Right. In general, you can use 2 different types of eye drops at once. We have people that use, anti-allergy drops, also lubricating drops. Folks with eye infections will also use like antibiotic or steroid eye drops. In general, when you're using 2 drops at once, you want to space them out. At least 10, 15 minutes between the 2.
Oh, that's good to know.
I would say in your case, we think about what is more important. I would say use the allergy drop first.
Oh.
Let that do its thing.
Okay.
And then, before you're about to go out, or at least 10, 15 minutes later, you can go ahead and put the Lumify in.
Okay.
And of course, this is all done before contact lenses. Of course, though, if you're having really bad allergies or you think you have an eye infection, any pain, irritation, do not use the Lumify. Do not wear your contact lenses. Come see us.
Of course.
Because it might as well be something else. The Lumify sometimes can mask the symptoms where we're like, oh, your eye looks fine. Like, I don't see anything going on.
Right.
So that's why we ask you, like, hey, what drops have you used today? Right.
okay.
But generally, it's usually safe and fine to use both.
Okay. Wow.
I think when you have worn contacts, you're the kind of person who's used to putting contact lenses in, doing eye drops isn't that big of a deal. But there are people who are like, I can never get eye drops in because right when I get there, I
Yes.
close right before.
Yeah.
What advice do you give to those people who do need eye drops but are reluctant to use them?
Right, right. So it is tricky. You're holding this little bottle with
Right.
a little
Yeah.
applicator. In general, you never want to actually touch your eyelid. You don't want to scratch your eye or introduce bacteria to your actual eye drop bottle. In general, you can shoot a couple times, but think of gravity. So always tilt your head back.
Okay.
Gravity works in your favor. Folks who have difficulty putting eye drops in their eyes, I always say shoot for the inner corners.
Oh.
So what happens is once you drop the tears, by blinking, a lot of times some of the drops will actually go in your eyes.
Oh,
Yeah.
Okay. That's a great tip for moms with
So
kids
yeah, actually
too.
with kids,
You know?
I say, hey, let's pretend we're at the beach. Actually lay down.
Okay.
If your kiddo does not want to open their eyes and you're not in the mood to kind of force
Pry
it
them
open,
open.
same concept. Have them lay down on their back, put a couple drops in the inner corners, have their kid blink 10 times. Like
Okay.
blink, 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 blink. Naturally, by blinking, some of those eye drops are actually going to go in your eyes. And a lot of folks don't realize that one little drop is more than enough for your
Okay,
eye.
good,
But if
good.
you feel that you've missed it, do a couple more. It doesn't hurt.
Oh, I have a random quick question.
Yeah.
What if your kid or yourself, my kid just got vanilla when we were baking in his eye, like it splashed. It was so scary. So I did what my mom would do and just like start splashing him with tons of water. Okay,
yes.
is that what you do?
Yeah, you want to irrigate
Just
your eyes.
flush it
yeah.
out. Okay.
Definitely just rinse the eyes with like water. If it's like a cleaning product or something more hazardous, definitely call poison control. But a good 5-10 minutes of just rinsing the eyes. Check for redness, irritation. Is your kiddo kind of closing the eyes? Take them to see an eye doctor just to make sure.
Okay.
Vanilla, I think, is safe.
It was safe,
but
but it does
yeah.
have alcohol.
Yeah, you want to be careful,
Which, of
right?
course, like I called my mom after that, even though she's not a doctor. And I'm like telling her over the phone, oh no, it has alcohol. So he tells everyone now, I got alcohol in my eye.
Oh,
I'm like, "You did
wonderful,
that?" Yeah.
wonderful. They love.
Like,
Don't
I let
they
my
love to do
3-year-old
that?
drink, yeah.
Oh my gosh.
Like,
No,
oh, geez.
yeah, bring them in.
Okay.
We see patients all the time. Hey, I think I got cleaner in my eye. My kiddo sprayed Lysol into their face.
Oh.
It's been so great conversing with you today,
Yes.
Dr. Hwang.
Thank you,
So
Dr. Hwang.
informative. Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.